Okay, we're here with Dr. Steve Flecknoe-Brown, who is the chairman of the Far West District Health Board. Steve, we've been talking about the digital economy strategy for Far West New South Wales. Could you please explain the overall perspective of where we're going and what we're going to do with this strategy?
Great. I'd like to talk from the perspective, from my perspective at the health district board level, the aspirations of the local health district, the needs that we have to achieve those aspirations. I'd like to speak in my role as a teacher, and of course speak in my role as a clinician. I'm a consultant physician and pathologist. So, firstly, we worry at the local health district level about the vast areas that we have to cover. We know that communication between health professionals is essential, both for patient management, for system planning, and for continuing professional development. And we know how dangerous these roads out here are, and we are asking people to travel hundreds of kilometres at a time to get to these meetings that we have to have. So as much as possible, we're having those meetings by teleconferencing. Now, we have teleconferencing facilities in all of our health services throughout the Far West, which is an area the size of France, with a population of some 35,000. But it's all very well to have the gear, but if you're all the time getting pixelation and dropouts in the signal and other irritating things going on, you don't have a very effective meeting in those cases.
So telehealth in particular is a very big area for our region. E-records too.
Yes. Look, I have to admit that the other part of telehealth is actual patient care, and having a good connection so that a psychiatrist in Orange can be interviewing a potentially dangerous person in a controlled environment in Broken Hill is very valuable. Having a geriatrician in Hornsby or Concord interviewing a confused elderly person and helping us make a diagnosis is very valuable. And the Commonwealth recently announced Medicare benefits to cover the cost of doing that. The Commonwealth recognises that telemedicine, actual clinical medicine practiced over a quality video link is valuable stuff. At the moment, we have every fortnight all of the cancer patients are reviewed with our oncology helpers, with our oncology partners in Adelaide, who've not been able to find the time to come up here physically. So there's all sorts of things going on with telemedicine, and then there's the system management stuff, which I'm concentrating on because I'm very much aware of it in my role as the chairman of the board. You said electronic medical records, and I agree they're very important, because you can do so much more with an electronic record than you can do with a paper record. You can pull up data, you can use information. You can use information obtained from those records in a de-identified way to improve the performance of the system. At the moment, unfortunately, here and possibly almost everywhere, but certainly it's very much obvious to us here, we have two parallel electronic medical records. One used by the general practitioners and the flying doctors, and one used by the hospital, and they are totally incompatible. They just don't talk to each other, which is a real shame, because you end up getting bits of paper floating around as well. And not only that, this area here is one of the best integrated health services. In other words, everybody in Australia knows that in Broken Hill, the GPs talk to the hospital talks to the flying doctors talk to the GPs, university and the Aboriginal Medical Service we're all tightly knit, because we have to be, because people in remote communities like this do that.
Steve, you said before we used to be on the cutting edge with some of this technology, but something's holding us back. What is that?
Well, that's it. Firstly, it was recognised that equity considerations meant that you had to have the very best of telecommunications in an area, in an isolated area like this. And so, some 15 years ago, we had the best, the fastest broadband in New South Wales, and we had excellent satellite upload systems as well. That's all just stood still, and everybody else has overtaken us over that time. The other, and that's unfortunately true to a lesser extent for the university as well, but certainly within health, we started very well, and we've just slowly been overhauled by everybody else, because everybody else has better access to high speed broad package stuff.
Yeah, so obviously the high-speed broadband delivery to this region is a priority from your perspective.
Oh yes. I understood when the announcement was made that this was going to be a great thing for this town, and for all of the rural and remote places in Australia. It's disappointing, to say the least, that we haven't got it yet. It's a huge advantage for all of the things, plus a whole lot of other things.